Hello, and welcome back to PIC University. My name is Harman Shavla, and I'm a pediatric intensivist. Today our topic is going to be a comparison between diabetes insipidus and SIADH. This was a topic that was brought forth by one of our viewers and really just wanted a quick rundown on how to delineate the differences between the two of these. So with that in mind, we'll jump in with our outline for today. At first, we'll talk about ADH, the primary hormone responsible for both pathologies. We'll then dive into the pathophysiology behind SIADH, talk about the pathophysiology behind diabetes insipidus, and then compare the differences between the two. So everything kind of starts here with ADH, or antidiuretic hormone. Now, ADH itself is secreted by the pituitary and has one of its primary effects on the kidney, at least for the purposes of fluid balance that we're talking about right now, and that's on that V2 receptor that's listed right here. What it does is when it actually gets to the level of the kidney, it retains body within the water, so it increases blood volume, and it kind of reflects that in its name, antidiuretic, in that it keeps volume from leaving the body. As a result, you wind up having a decrease in urine output, and this decrease in urine output causes a decrease in serum sodium, and it has an increase in blood pressure for two reasons. One of those reasons, of course, is the increase in blood volume, but the other thing that it also does is it actually constricts blood vessels once it affects the V1 receptor, and that leads to, again, an increase in overall blood pressure. So the alternate name for ADH is actually vasopressin. When we start talking about SIADH, SIADH actually stands for a syndrome of inappropriate ADH secretion. So as you can imagine, this basically translates to an excess or an increased level of ADH that's produced. As a result, there's a decrease in urine production. And when you hang on to free water through the urine, this basically gives you increased water retention. It overall decreases the sodium in the body. So the big two treatments that we wind up looking at when we're looking at SIADH is one being water restriction, and two being 3% saline, and that's really to primarily treat the hyponatremia that comes along with this. As a result, these patients also have some degree of increased blood pressure. Now, when we start looking at diabetes insipidus, this can be done in one of two ways, and it really depends on what's happening. In reality, ADH's function is not being carried out, and that could be from central diabetes insipidus, where the pituitary actually isn't producing ADH, or nephrogenic diabetes insipidus, where ADH is being produced, but the kidneys are really non-responsive to it. As a result of not enough ADH being produced, the patient winds up having a high amount of urine output, but the urine that's produced is quite dilute. In addition, as we start losing that free water, we have a marked rise in our serum sodium, and the patients wind up being hypovolemic. Treatments for DI really looks at thiazide diuretics, and again, it seems a little counterintuitive that if someone's peeing out a lot that you give them thiazides, but in reality what winds up happening is that you wind up excreting some sodium with that. We also look at desmopressin and vasopressin as well. So here's a quick comparison between the two. SIADH really is a state of low urine output, whereas DI is a state of high urine output. In SIADH, we have high levels of ADH being produced, whereas DI is low levels of ADH. And as a result of this, low levels of ADH gives you hypernatremia. High levels of ADH give you hyponatremia. Overall, the patients wind up being hypervolemic with SIADH and hypovolemic with diabetes insipidus. And the treatment for the two is a little bit different too. SIADH requires 3% and water restriction, whereas DI really looks at diuretics, primarily thiazide diuretics, desmopressin, or vasopressin. We thank you again for listening to our talk today. As always, please feel free to subscribe to our channel. Don't forget to hit the like button. And if you guys do have any other videos that you want us to touch base on, we'll happily do those. Thank you again.